Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Da, 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 da.
Da, 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 da.
Mr. Richard.
There he is. Well,
Richard and I were friends on Facebook.
Oh, you are?
Oh, yeah.
Oh, I know you are.
Richard.
He's telling me about what you're doing. He
That's
says
my partner in crime.
He says, is he amazing, all the work he's doing on the Facebook page?
Richard, did you get to see the fox in the background of in the backyard of my house?
You have a
check it
fox?
out.
Yes.
There was a little fox in the. Oh yeah, I gotta show you.
Oh my goodness, a little
Yeah.
red fox?
A little fox. He came
Oh.
He came for happy hour. I was having a chat.
Are you feeding him?
I was having a shot of Grandma here, and
Yes,
I see my
you have to-
glasses empty. I see my glasses empty,
And he's drinking it?
and no, I'm just kidding. He
Oh.
didn't drink my.
Oh, look at the fox.
It is a fox.
Oh my heavens, he's so
backyard.
cute.
He said, "Oh, this guy, poor guy, all by himself. Let me go and keep him company." So he came by to keep me company.
No, that's really interesting. Now, just be careful that he doesn't have rabies and doesn't hurt you.
I
See, I'm your doctor. You
I
know,
ta- I
don't want-
taekwondo
Yeah,
shot
I
him.
know taekwondo. Right as he grabs.
Chop, chop.
chop chop. Then I put on the microwave.
Yeah.
No, just kidding.
Oh, that is really bad.
No, but people say fox, you can keep it as a pet.
But maybe as a baby. But now what? It's a bigger. No,
No,
please
yeah,
don't do
not
this.
that one from the
You know,
street.
because we have all sorts of little animals around in our area, and Snowy's always very inquisitive. But when you start to get, wild cats, feral cats, and you get the raccoons and all,
Yeah.
you gotta be careful. I gotta
Yeah,
take
you
care of
know.
you. Yeah, I worry about you sometimes. He's out in his pool
Right.
enjoying
Yeah.
himself, right?
Yeah, the
All right,
fox
so-
jumping in. What did the fox say?
Oh, my God. Here we go.
I have to just tell you something interesting. We've never
Let's
talked
talk about detox.
Yeah. Well, I want to because actually the detox
The
that
myth. That's what I want to do. My next book.
What?
The myth and facts of detox.
the myth
know-
and facts of detox.
Yeah, because detox. We are in such a.
Well, what is the word detox? Let's just say, what does that word
when
mean?
you get intoxicated. To get intoxicated is when you take something that's harmful to your body. Now, there's different way of intoxicating the body. You can drink excess amount of alcohol, and you can get intoxicated. You can get intoxicated with nicotine when you smoke if you never smoke, because these are foreign chemical to the body. Like we just heard the half hour prior, there are many chemicals that basically do not belong in the body, and if they do, it's in very tiny quantity. And when we use deodorant, when we use hairspray, pesticide, a lot of the environmental thing that we use today, thing that we make to make the seat of your car and the steering wheel of your car, all of these things can be intoxicating your body, and we don't know about it. And we really don't know about it. And I think in the future, in my future, the way I see it, and I always try to be ahead of my time.
Yes, you are.
In my future, a true detox center should involve people like the lady we just listened
Leslie
to.
Carmen.
Yeah, Leslie Carmen and Nicole,
Andrews, the marvelous
Nicole Andrews,
with
that
food.
she worked in the food section, and then the physician and the nurses. But then we cannot forget the environmentalists, because those are right now our scientific arm on detoxification is very segmented. So if you want a detox, you might go to Nicole, but you won't see Carmen, or you might see me, but you won't see Nicole. And it's I think in reality, it's a true detox center when all of these things combine and they all come together.
I think that's genius, actually, now.
Yeah, because then you have all these testing systems available. And some of them you might be able to do at home, but some of them you might not. Some of them you might need to come to the doctor.
Maybe we need a pharmacologist.
And we absolutely need a pharmacologist. Yeah.
Because then you have certain drugs or medications to, to get rid of things if you have to go that way. But yeah, I've never thought about this before. And an environmental, it's a detox center, but it's comprehensive. That's who you're all about. You believe.
Well, I believe
everything.
in prevention. I mean, it's good that we are working on detox. But as we went off the air, we started listening to the patient about other things that concern him. And some people might say, oh, he's crazy, listen to what he's saying. And other people might say, let's investigate.
Other people
Let's
say,
research this.
I have the same problem. Let's research
Right.
it.
How do we know that the toothpaste that we use is clean or it's not clean? It's healthy or it's not healthy? We really
So
don't
how
know.
do you research something like that, Dr.
Well,
Mencia?
we need to start from the root of the problem. At the university, we need to create an army in science that work with the chemical that human and animal get exposed to.
We need
because
a chemist.
we cannot be. We need a chemist that specializes, an environmental chemist. So I brought this up a long time ago. And
Really?
yeah,
You saw
yeah.
this coming.
I saw this a long time ago because I've been thinking like, it would be okay to be treating patients and you can make millions of money, doing this, but that's not what science is all about. It's prevention. How can we start preventing the next generation, from having problems?
But when you go down and you think about it, it seems like we have more problems today, or is that because we're more scientific today that we can discover, or do we really have problems in the air, as everyone says, and we're just ingesting all
we
this?
definitely have problem in the air. It comes with advancement in the environment. I mean, you go to the jungle where the air is fresh, and you become a different person if you stay there. If the snake don't bite you.
Yeah, but you come from Hawaii. In fact, we just had it the first.
I heard, yes.
Yeah. But it was such a wonderful thing. But in Hawaii, has Hawaii changed today?
Right. If you go to Waikiki, it's a metropolitan area. A lot of cars and a lot of alcohol and smoking. You go to a discotheque, it's full of smoke. So. Yeah, if you go to Waikiki, yes. If you go up in the mountains, like we used to have people that would come and train with us. And I remember Bruce Lee, one of,
Bruce Lee.
Yeah, he used to come to Hawaii to train. And we used to go in the mountain and train and do martial arts. And when you go up in the mountain, it was like you come rejuvenated.
And that's because of the air.
Just the air and the nature of the environment.
Okay, but let's just, the news reports in China and other places where people can't even breathe.
Right.
I mean, so this is pretty serious stuff.
It is serious because, you look at the people in China and New York and other communities, and you see the people walking with their little mask on their face. And they say, okay, so I'm put on this mask so I can protect myself. Well, guess what? The skin is the largest organ in your body. So whatever your skin get exposed to, unless you dress, with and cover your whole face and cover everything. But then if you leave your eyes out, your eye is in intimate contact with the rest of your body. Think about it. If you take an eye drop because you have glaucoma and you put on that eye drop, in a few seconds, if the eye drop is a beta blocker, that is the same thing that we take in a pill form to slow down the heart. You take the eye drop, it will slow down the heart just like a pill. And I had a patient, I told you the story before, I had a patient that went to Imperial Point, and the cardiologist was going to put a pacemaker. And he called me to do a consultation because an elderly patient, the family say, we want a geriatrician to do the clearance before you put a pacemaker. So they called me in. And I asked the daughter, is this all the medication she's taking? She goes, yeah. any eye drops. At her age, she, probably should be taking eye drop. And I saw the fact that she already have eye surgery. And she goes, yeah, she take 3 eye drops for the glaucoma. Well, what are they? Oh, let me call my husband at home. So we call the husband, and 2 of them, by mistake, she was taking beta blockers. So 2 of the same. And I canceled the surgery. And the cardiologist was super angry. How dare you? I gave you the chance of giving the clearance to my patient. That's how he put it. And
you want to kill her?
And I said, well, you didn't give me a chance. The family requested a clearance by a geriatrician. So you cannot take me off the case, number one, because it's upon family request. But now me as the primary, I can get you off the case as a cardiologist, but I won't do that. All we want is the best for the patient. So what I want to do is take the patient off the beta blocker for 48 hours. A pacemaker or anything, she's in the hospital. We don't need a pacemaker. It can wait 48 hours. If she truly needs a pacemaker, you're going to proceed. So unless you have planned to go on your boat or something like that, we're asking just for 48 hours to see what's going on with this patient. Lo and behold, she came off the beta blocker. The heart rate that was in the low 30 jumped to the mid 80s. So I asked the cardiologist, do you want to put a pacemaker, sir, on this patient? And he said, no, Dr. Mencia, no, you're right.
Well, that's why I have always admired you so much, Dr. Mencia, that you do go the full, you really analyze that person. I've talked to you about this before, that you really should have another name added to your geriatric physician. You should be diagnostician. I really mean that. You have a certain talent for that you just look at the whole scene and you ask the right questions and you inevitably come up with the right answers.
And when it comes to environmental, we have to look at the body, what we get exposed to. You look at the couch where you sit to watch TV, the cup that you use. I saw one of my staff in the office, and she wanted to drink hot tea. So she couldn't find one of those cups that were meant to put hot. So she could have one of those cups that are for water, and put the hot tea in there. I say, don't do that. She goes, no, but it's just, I'm going to drink it fast. So I say, no, it's the chemical. What you are doing, you're taking the plastic cup and you're making the plastic cup melt and release some chemical that then you're going to ingest. And, you don't know what that's going to do to you. And she thought about it. She said, oh, my God, I do it at home all the time. I say, no, don't do that. Use a regular cup. We have regular cup there. Use a, real cup. And
I'm very specific. It's funny. It's not that I mind we have styrofoam cups in front of us, but when I drink hot drinks, I always try to have a regular glass cup. Isn't that interesting?
Right.
I think
same thing using, some people would not use plastic fork and plastic spoon.
Is that right? No, that I hadn't heard, because it's the same thing. They're eating
the same
with
thing. You're eating
plastic or whatever has to make plastic.
And, a lot of things get recycled. So maybe that plastic came from the garbage bag plastic.
It's true. You never know, right?
We don't know.
No, but
a lot of things that get recycled, we know, things get processed and things like that. But I think, a detox center, which is one of my dreams.
Oh, I think
if we get the funding for that, I would probably.
I think we have to talk to Carmen Care if she's going to go after funding in that organization that she was getting more information from.
Mm-hmm.
Maybe she ought to be a part of your team, and because this is what's so interesting for her. I don't know if she has the time, but I love that.
I have proven with the geriatric center, and we do both internal medicine and geriatric. I have a lot of young patients that, we have some situation that I put the whole team together. And you met one of my patients with the breast cancer.
Oh, definitely.
And, she tells you.
She's ready. Is she back here yet? Because
she's back. She's back. She came to see me.
Oh, we have to get her on the show.
And she said, I'm alive because Dr. Mencia put a superstar team together for me, and they
That's
were
right. I
able to take
remember.
care of my breast cancer. Remember?
So
She was
you
talking
love
to you.
that. So that's what
So
you do.
and I think in many things when we are able, to by myself to do an environmental center is worthless.
I
It
love
would be
this.
worthless.
I
think
look-
is to
If
bring
I
all
looked
this.
up on the internet environmental centers, I bet I wouldn't find any down here in South Florida.
In
Maybe
nowhere.
we have to do something. Oh boy, we're now in trouble. Ina, get another hat on.
Yeah. You're gonna apply. You're gonna apply for the budget.
Another environmental center. But I just want to tell everybody, I know when they listen to you, they always are so anxious to call you or to come visit you. The phone number in Fort Lauderdale on Commercial Boulevard for the AGI Medical and Dental Centers is 954-489-1345. I'm just going to do that slower. When people give me phone numbers over the radio, I can't get it.
954.
It's a broken record here. 954-489-1345. And if you want to go, Boynton Beach is more convenient. You can go there, and that's 561-270-6494.
When am I in Boynton Beach, in May?
6494.
Yeah, in May I'm going to be there seeing patients.
Oh, you are?
Yeah, from the symposium, we have some patients that are going to come
I'm
in.
sure.
And they're going to come
People
in, so they're
loved you.
going to they
So
set them
you'll
up
make
for
a-
May.
So what will you do? Will you go there maybe once every
Once a
week
month,
or once a month, and you make an
or twice a
appointment?
month.
Right. Well, so
and go and
that's
see the patients. Yeah.
that's really good. I'll have to go up there and see this.
The other thing is, the dental, different
Right.
specialty need to get involved. The cardiologists, because they put stent in the heart. The dental, they put fillers in your mouth. They put bone graft. And nowadays, I'm doing the research as we speak in buying the equipment. And my friend from Hawaii can help us with this. I'm buying the equipment to centrifuge the blood, so we can do fresh frozen plasma instead of bone graft when we are
Oh, I
treating
don't
the patient.
understand that. Explain
Fresh
that, please.
frozen bone graft comes from cadaver,
Yes.
and you put it. Let's say you extract a tooth, you pull out a tooth, and you have the hole in there. So you put some bone graft to
Right.
fill the empty space, and then close. You can take the patient's blood. Before you do the extraction, you take the patient's blood, you put it on the centrifuge, and when you centrifuge the blood, you are separating in layers, where the heaviest blood cells will go to the bottom, and the platelets that are basically without nucleus, they are very tiny, go on top. So with a pipette, you pull out those platelets, you centrifuge your blood again to purify it more. And then you take that fresh because it's coming out of your blood, plasma and platelet concentration, and you put it in the hole. So you take your own blood, you take part of your own blood, and it will heal, and it will do the same thing as the bone graft is doing. We will get the same result. It won't do the same thing because it's very different to put a foreign bone graft in there versus to put your own blood in there. But it will create the same thing, if not better, and much faster because your body is recognizing.
What you're talking about are stem cells, almost.
Like stem
Because
cells.
that's
Yeah.
right.
It's
Because
stem cells,
exactly because it's your body, and then it's going to build new cells.
So since I have a dental department at both center, I'm actively looking at the right equipment so that we can start doing fresh frozen plasma right after extraction
Amazing.
in the dental work that we're doing.
Sounds right to me.
Right.
Well, that is really innovative.
It is. And
So-
it's a lot of things we can do. And like Carmen was saying, our body is meant to heal itself.
Now,
You
you've
know, it's
always
really
believed
meant to-
that.
to
Yeah,
heal
you've
itself.
always
So-
believed that, and I do too. And it's
We just have to understand the body. We know so little about our body, and we have to be honest to ourselves. People say, doctor, you're going to give me this pill. How does this pill work? Well, if I'm a national speaker for many pharmaceutical companies. And a lot of times when I'm talking to colleagues and nurses and nurse practitioners, we let them know we don't know the actual mechanism of action of this drug. We know that if you take it, and you have this bacterial infection in your urine, it's going to take care of it. We know that if you take this medication and you have an enlarged prostate, it's going to help you pee better. But actually how it's working, we have no idea.
And how do you find that out?
Through research and the fact that, let's say, some medication work by inhibiting, let's say, for the prostate, inhibiting the enzyme that will activate the testosterone to enter the prostate, and because one of the things that it will do is to inhibit that enzyme, your prostate is going to shrink. Fine and dandy. But what else is it inhibiting? We don't know.
Is that why when we listen to a lot of the pharmaceutical ads, it says you take this, but you can have this, and
all
it
the
gives
side
you
effects,
all
right.
the other things. But you could call or you could have a
and that's
contact.
why, that's why an environmentalist being part of this is so important, because you listen to all of those side effects, and they are not true either. Do you know that?
No.
All of those side effects, they are not
You're
true.
kidding. Well,
No.
why are they?
Because let's say you have a drug that belong to the antidepressant family, and the same family of drug 20 years ago was studied, and X number of patients, let's say out of 1 million people that were treated, 7 patients had a epileptic attack, had a seizure. So then the FDA say, okay, you have to document that this drug can produce a seizure. Now, are we certain that the drug produces a seizure? No, we are not certain. But because X number of patients had it, we have to say that the drug can produce a seizure. Now you come with a new drug on the same family, and the FDA will make the pharmaceutical company write down that seizure is a possibility when taking this drug. Now, you might have millions of people taking the drug, and you might have nobody having a seizure. Then somebody come even with an even better drug for depression. But you inherit this side effect from other drugs from the past. So even the side effect, I tell my patient, is all of that is not all true. It's there because it was inherited from other similar drugs that were there, but it wasn't as clean as this drug. You look at the drug like Celexa. It's a great antidepressant. I used to be a speaker for the company, so I know the drug very well. Then the company came, and Celexa was basically most drugs are 2 arms, a right arm and a left arm when you study the chemistry of the drug. So one, when you put on the beam of light, will get a right rotation, one will get a left rotation. We call levo and detro chemical. So it's like having a mirror image of the drug, right? So just like my 2 fingers, my 2 hands, right? My thumb. So one is to my right, one is looking to my left. The company decided, this Celexa is such a great drug, but it has some side effects that it's producing. So one of the chemists say, what if we purify the drug and break it into the left and the right arm? and then give it to patients? What will happen? So they purified the drug, and one arm was responsible for the side effect, and the other arm was responsible for the antidepressant effect. So then came Lexapro, a new drug. And Lexapro was a cleaner version of Celexa, but you inherit all of the side effects from Celexa because it came from the other drug. But it's a completely different animal if you think about it.
I was not aware that you were so well versed in all the pharmaceutical.
I love medicine.
Yeah, I know you do, but see, so you were working with. Well, we're running out of time again. I've got to give your phone number, and it's terrible. Go home to your fox.
Great job.
Your fox.
I know. What did the
phone
fox
number
say?
is 954-489-1345. 954-489-1345. And remember, if you're a home patient, you can't get out. This is probably one of the very few. It's rare. They will send people to help you. They'll send their nurse. They'll send Dr. Mencia, whomever they have to send to take care of you at home. And it's the website is agifl.com, agifl.com. And we didn't really do much with you, Ina, but I know you're very involved with and we have to stop.
Yeah.
You're very involved with the home care, and that's a wonderful thing. So, maybe we'll have you come on another time and talk about the home care, what happens there, and how you're able to manage that. Okay.
When we're going to do
That
the
would be great.
symposium in Hallandale.
Okay.
We'll do it.
Okay, that's it. Thank you. We'll be back another time. Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.